Your heart stopped?
Yeah. They had to use adult doses of shock for me.
So it was necessary to try to revive you, to resuscitate you?
For 32 minutes.
That's a long time.
It's a long time.
So what you just heard there is Bradley Gibson, one of Beverly Allitt's victims. He survived. He went through quite a trial afterwards, and he is quote unquote normal now, if you don't count the psychological distress and trauma that he's gone through. So, yes, I'll tell you more about that later. It is Karen and
Mary,
and we're here to do part 2 of the Beverly Allitt story. So, hopefully we'll get through this in this episode, but it may take another after this to get through it, because we may be filling it with some angry comments, but we'll try to keep that down to a dull roar. Okay, do you want to just get into it?
Yes, so that was from obviously from a documentary about her.
Yeah, actually,
BBC
it is
or
about
something?
her, but it's more about the victims. I'll put the links in the show notes so that if you guys want to go watch it in full, you'll be able to. So, well, we didn't do an intro. I think everybody knows what we're all about, but in case you're a first-time listener, hello, hello, hello. Welcome to Stat, Shocking Traumas and Treatments, and I am your host, Karen Wickham, coming to you from beautiful Toronto, Ontario, Canada. That was my cat climbing, and that is the last noise you're going to hear. They have been amazing all morning.
They have been.
We have construction going on. It's finally stopped for a second.
Oh my God.
And now the cats are like, let's play. And if you let them out, what do? They
cry.
friggin' cry. So we're going to try to keep this as good sounding as possible. Sorry to break in. This is a very serious story, but I don't know. I just thought we'd warn you guys. We want to give you the feel like you're sitting in a living room talking about
Hanging
this.
with us.
Yeah. So I hope that works for you. So as you can hear, Mary is here today.
Hello, everybody.
But I think Mary's going to be here every day. Every day that...
I hope so.
Yeah.
Oh, you mean on the show?
On the show.
Yes.
Whenever
possible, I'll be joining Karen.
Yeah, we want to. We like working together, and we liked the conversational part of this. But anyway, okay. So we hope you like it too. Let's just get into this now. Okay, on March 5th, 1991, another child died in the pediatric floor at Grantham Stephen Hospital. It was 11-year-old Timothy Hardwick. Now, Timothy's life began with tragedy, if you want to look at it that way. He was born with severe brain damage, diagnosed with CP. He was blind, mute, and couldn't walk. For obvious reasons, this made him very vulnerable because he couldn't express himself. He couldn't, Allitt's in there doing her horrible things, but he couldn't say, this hurts, or stop, or relay back what he could remember.
Or why are you giving me that?
Yeah.
I want my mom and dad.
Yeah, exactly. He was quite young. Yeah, he was 11, so he could definitely express something, but this made him absolutely 100% vulnerable. He was the youngest child in the family, and Helen and Robert Hardwick had a daughter, and they were hoping to have a boy to complete their family. And Helen became pregnant when her daughter was 6 years old. They were a really healthy, active family. They would go out and go on trips and walks and do really, active things with their family. So they were looking forward, now we have a full family and this will be great. Her pregnancy was uneventful until about 2 weeks. And then she became really ill. She developed hydrocephaly.
Oh, goodness.
Yeah, and had to have fluid removed from her brain.
That's serious.
Yeah,
Affect the fetus too.
It seems like a pretty unusual thing to happen. I haven't really even, I don't know every pregnancy that's out there, but that's definitely an unusual symptom unless she already had something underlying going on. And, you just don't go have a random CT scan when you become pregnant, to
So she must have started to exhibit symptoms. Maybe she had a tumor or something.
I don't know. Well, we'll talk more about that. So she had the surgery to remove the fluid and try to, correct the problem. And 2 weeks later, Timothy was born via C-section. Everything seemed to be great. He seemed healthy. But shortly after, Helen had a stroke.
Oh, no.
Yeah, and her entire left side of her body was paralyzed, and she developed epilepsy. Yeah, so her husband Robert had to take leave from work to care for his wife and his newborn and his 6-year-old daughter. So as Timothy got older, he was not reaching his milestones. Yeah, after a series of tests, it was determined, like I said before, severe brain damage, cerebral palsy, blindness, and unable to walk and talk, and epilepsy as well.
Yes, I often tell some of my clients this, that cerebral palsy is not, it's usually from lack of oxygen of some sort. It's a hypoxic event of some sort. So, I had one client who had moderate CP, and she had a stroke as a baby, like as she was being born. Mm-hmm. So there's usually some sort of traumatic, so maybe the hydrocephaly in the mom affected him somehow.
Yeah.
Because the other way that babies get CP oftentimes is, sometimes through difficult births when there's too much compression on the head and the cord is wrapped or something, or vacuum at too much compression in the cranium. So
some of it, or a good majority of it, is you can call quote unquote doctor error. Now, I'm not, things happen during pregnancy where you have to do whatever you need to do to deliver the baby, and sometimes, like you said, suction or forceps can cause this to happen. So it's, sometimes they are a healthy newborn until complications take place, and this can happen.
Yeah, and since he was born by C-section, it must have been, in utero
something
that happened.
Yeah, something happened, maybe during the, when she had her surgery and stuff like that, like something might have happened. But, so yeah, poor family, right? Mm-hmm. So after the test, they found the degree to his disability. And unfortunately, they were unable to care for Timothy because his disabilities were so profound. And, with the mom being paralyzed on her left side, they did this reluctantly, and, very, very sad situation. But, I've seen families whose child was profoundly disabled, and they decide to care for the child at home. This is very delicate how I want to put this.
Okay.
And they're married or not, I don't even know why I said married. Mom, dad, however you want to look at it.
Possibly other children.
Yeah, and then other children in the family. So I'm going to give an example of a mom and dad who had 3 children, and then their child was born with severe brain damage. She had just pretty much her brainstem and a little bit more functioning. And by the time, she was frequent in and out of the ER because she would have many, many, many different, things that would go on health-wise, seizures, difficulty breathing, infections, such and such. This mom was convinced that this child was communicating 100%, like she had suffered no intellectual damage, which 100% was impossible. The other 3 children were getting next to no care or attention from mom. And the dad was basically working full time to be able to support the family, and therefore wasn't able to give attention to the children as well. And their marriage was done. They were just, it's unbelievable what parents will tell you, because they need someone to talk to, kind of thing. And he was working to provide for his kids, and the kids basically lost their parents. and this, all the attention was given to this, child who deserved the best care possible. But you see how this family fell apart completely. You know what I mean? So sometimes the best decision is to put the child in care where they can get the 24-hour care that they deserve and they need. Because you're not doing the family or the child, you're doing them yourself and your child a disservice if you're unable to give proper care and things like that. Now, however, that's experiences that I have witnessed. And whatever you decide for your family is what you decide. I don't, please don't anyone take this as me saying, oh, your child should go into care.
Well, I think you have to.
But, in that situation, it shows the repercussions of it. And, you see what I'm saying? And but there's also a lot of care homes that give terrible care to, I don't want to say a lot, but there are care homes. You hear about the horror stories of someone being completely disabled and
but then there's some that aren't. I mean,
that's the point.
I know
that's
someone
the thing.
whose child has got a condition, like same thing. Okay, so then I'm gonna not neglect, but I'd be doing a disservice to myself and my family when this place is fully capable of taking care of her. And this particular condition, she has like violent self-harm things and stuff.
Just because
she visits her regularly and stuff, but
just because
she's happy there. Right?
Exactly. Like just because the child is in care at a at a hospital or care center, it doesn't mean that you don't stop loving your child, visiting your child, and parenting your child. It means that they're getting care and you can provide the best love that you can, and then also toward yourself, your family, and So, I think about how tough that decision is. How do you weigh? Are any of them considered a good or bad decision? I think it just has to be weighed. How it's best for all. And like I said, the disabled child may not get anywhere near the care or stimulation, socialization that they would if they were in a good facility that cares for them. And of course, a lot of times money is it's prohibitive. Some people can't afford. So it's
in this
tough.
case too, you had one parent who had serious disabilities themselves too,
exactly.
Right? So
that's a moral, ethical dilemma here that each family has to go through on top of everything else. So I'm sure every parent makes the what they think is or believe or in their heart is the best decision for their child. I just wanted to speak at both sides of it, just to demonstrate how difficult this can be. So, in this case, the care home that Timothy went to was absolutely amazing. And it was only about a half an hour away from the parents' home. So he thrived there, and he was well cared for and loved by the staff. And he, as best to his ability, knew that who his parents were. They were his mom and dad, and they visited him all the time. They were very involved in his care. So, it turned out to be a really great situation because he, got everything he needed, and the family was able to carry on as well as a unit. It was just, unfortunately he couldn't be at home. Now, they said he was a happy boy. He loved music, and, he was just a real joy to everybody. So on Tuesday, March 5th, he had been having a series of seizures that they were unable to control. And he went to Grantham Hospital. Allitt was the nurse assigned to care for him. So he had been improving over, a couple of days, and he was stable. And his, like I said, seizures seemed to be under control. Allitt was assigned as a nurse for his care. And he had been improving. And his seizures, they seemed to be able to, give whatever medications to get them under control. But by 6:30 that evening, he was dead.
Wait a minute. What? 6:30. So he came to the hospital, and by the end of the day, he was dead.
He was dead.
Before dinner time.
Yes.
And yet he'd been improving.
And he had been improving. So I don't really have a lot of details around
sort of the
what happened, but I can say she was his nurse. He was improving, and then he died. And at this time, his death didn't come under suspicion. So he had comorbid conditions, so that could be written off as a natural death or suspect. You know what I mean? Like they could, So there was no.
Did you just like go into arrest or something, or?
Yeah. Well, yeah, respiratory arrest, and he died. So.
So they would think, oh, maybe something to the seizures. It was too much for him.
Exactly.
Something. Okay.
Yes, exactly. So, and especially if a child is, or any person is not very, they don't move, they're not in motion a lot, walking, moving, stretch. You can get clots, at risk for things like that. So they weren't exactly sure what caused it, but they didn't rule it as a suspected or unnatural death. But in time he would be confirmed as her next victim. Okay, now let's talk about Kaylee Desmond. She was in the hospital between March 3rd and 8th, and she was 14 months old at the time. She had spent a lot of time in the hospital because she was born with a cleft palate and couldn't feed. So she was there for about 5 months, and everybody knew her, and she was well loved by the staff. Remember, it's a small hospital, and she was on ward 4 to recover. Her parents were constantly at her bedside. They took turns, so she was never left alone. She always had mom or dad there with her. So on March 3rd, Kaylee was admitted to Ward 4. She was fighting a chest cold that had turned into a chest infection. She had been on antibiotics at home, and it hadn't cleared it up. So considering her history and age and things like that, decided to bring her in and admit her to Ward 4 for observation and some treatment. So over the next 6 days, she was recovering nicely. And as before, her parents stayed at her bedside, never left her alone. On March 9th, Kaylee went into respiratory failure around 1 a.m. After being recovered, it happened another 2 times up until 4 a.m., where it happened a 4th time. She was transferred to the NICU at Queen's Medical Center in Nottingham. From this point on, I'm going to call Queen's Medical Center QMC, okay?
Okay.
So with intensive support, she started to recover well. However, she had suffered significant brain damage from lack of O2. 3 days later, she was back on the ward and went home shortly after. No one could figure out what had caused her respiratory failure. Now I'm going to talk a little bit more about her, or I can actually talk a bit about her now. Now as an adult, she...
so she survived.
She survived, sorry, yeah. She survived, and... but she had severe brain damage, and intellectually she's quite she may be functioning at a 5-year-old, 6-year-old level, but she can walk and feed herself and stuff like that. But she has massive anxiety, even going into her 30s now. She has to, like, her mom and dad have taken care of her. Like I said, she was like more high functioning, but I mean, this should never have happened to her. But she has nightmares. She has to keep her closets doors open. Her parents have to check under her bed for her at night. And her bedroom door has to be open. And her anxiety is all day. Like, she'll look around because she thinks Allitt is coming after her.
So did she, I don't know how you would interview her, but she was like 14 months old. So would she have memories?
Yeah, she does have memories of it. In fact, I have an interview with her that I'm going to see if I can put together and play. I just want to, I got to be careful with copyright stuff and whatever. But yeah, I mean, in the video, she's terrified, and she was crying and anxious and had to stop sometimes because of the trauma that she's gone through. And it's just
Poor
been
thing.
horrible for her. Yeah. And at one point she got a settlement when it was all said and done, I think for like $11,000. So like, 20 grand here. So $11,000 or pounds for all of her pain and suffering and trauma. Okay. And that's not, here's the kicker. She was getting support for her disability benefits through the government. Then a few years later, she was awarded this $11,000. They made her pay back the disability payments that she got and said she's no longer eligible.
What the fuck?
Yeah, I know. Absolutely, absolutely atrocious. So that's, kind of gives you an idea of what happened long term with this woman. It's just, and family. I mean, it's absolutely horrible. So let's talk about another little boy, 2-year-old Yik Hung Chan. He's also known as Henry, and his parents, Eddie and Jenny. He was happy, energetic, just full of life. He was an amazing little boy. On Thursday, March 28th, he fell 20 feet out of his sister's bedroom window, a complete unfortunate accident. Yeah, and he fractured his skull in 2 places.
That's serious.
Mm-hmm. He was admitted to Ward 4 for observation. And over the next few days, his condition worsened. He had severe headaches, nausea, vomiting, and lethargy.
Yeah, possible swelling on the brain, I would think.
Or meningitis, different things like that. I mean,
Right.
think about what happened, anything like that with a head injury.
Subdural hematoma, yeah.
Mm-hmm. So it was looking like he was going to need to be transferred to the NICU at QMC. So on Sunday, he spiked a high fever and started having seizures. Now, the seizures could have been from the fever or completely unrelated. His heart rate climbed and he went into cardiac arrest. He was resuscitated and then transferred to QMC. The CT scan revealed a blood clot in his brain, and he went home the next day. His cardiac arrest remained a mystery.
Would they send a kid home with a blood clot the next day, like from the brain? That seems kind of...
Yeah, I guess it depends on whether it resolved itself or they resolved it, or, I know it does sound awful fast to me.
Yeah.
Yeah.
I'd be like, but I mean, I guess if...
Now, I want to break this down a little bit because other kids...
Well, a kid blood clot would be different than like an adult from years of like smoking and drinking kind of clot or something, probably, right?
Well, I think a clot is a clot, but no, I see what you're saying. Like all the other...
Plaquey clots,
yeah,
that kind of thing, right?
All the other vessels would be healthy. They wouldn't be all
Right, yeah, whereas
gummed
his
up with
was
stuff.
maybe a clot from the fall.
Or the clot because his heart stopped.
Oh,
And, it caused a clot. So this is where I'm looking at it because other kids had cardiac arrests on that floor. So I'm wondering if it could have been from that or it was unrelated. But cardiac arrest, kids don't have heart attacks. And then a clot in the brain could have been from the head injury, but it could have been because his heart stopped or maybe the meds she gave. Okay. So I just have that in the back of my head, made me think. The next little guy we're going to talk about is Paul Crampton. He was 5 months old. He was taken into hospital on January 20th, 1991. And he was admitted to Ward 4 with bronchiolitis. Over a period of the next 3 days, he had been doing well. Like he was recovering nicely. And Allitt, unfortunately, was among the staff caring for baby Paul. So soon after these 3 days, he suddenly fell very ill. He was diaphoretic, so extremely, sweaty, pale, cyanotic, so turning blue, and seizing. His blood work revealed that he was in severe hypoglycemic shock. Okay?
He wasn't diabetic.
No, he had not had a history of diabetes at all.
He was only 5 months old.
Yeah, I mean, that doesn't mean anything.
Okay, but still.
But yeah.
It wasn't why he was there.
Yeah. Out of nowhere, his blood sugar dramatically went into the boots, and they had to slam him with medication to try to get it back up. So he needed emergency treatment to recover. And raising the blood sugar of a child is a delicate process. You just can't slam fluids and stuff like that into them because their brain will swell. Okay. And you have to delicately look at the electrolytes.
Not the same as an adult, right?
Exactly. The first time that I was in the ER treating an adult, I mean, there's a huge protocol, but they were flying fluids through this to this person with potassium and everything, and I'm like, whoa, wait a minute! I saw 2 bags of saline with potassium in them. I'm like, did someone fuck up with the
right, because
with the fluids?
Come from
because you
kids.
would just never do that with a kid. And then I'm like, I mean, I didn't in my head I was what the fuck, and then I looked at the orders, and then I was I talked to staff, to a coworker, and sort of just did a quick explain, and they're like, nah, they kind of chuckled it off, and Of course, I was going to follow. But the first thing that hit my head was, Jesus, no, what is going on? And
yeah, because you're used to treating itsy bitsy babies or kids, right?
Yeah, kids. So, I mean, that was, it was like one of my rude awakenings that, okay, you're no longer in, you're no longer in Oz or whatever. So, yeah, so it's like I said, it's a delicate process. So while this was going on, Allitt was overheard saying that little Paul had hypoglycemic well before the blood work results returned. So
okay, so I was gotta get this right. So hypoglycemia, so low sugar.
Yeah,
right. So his insulin was too high.
It was really high. Yeah. Okay. So
how would she know that?
Exactly. Mm-hmm. So he becomes very ill. They're treating him emergency treating him, and she's like, I think it's his blood sugar. Okay. Of course the doctors already suspected that because of his symptoms. Right. But still, it's like, how would you know, Beverly? Mm-hmm. So even though the doctor suspected it, like I said, they treated him and but like before the blood work came back, she magically knew what was going on. He was stabilized, but this happened 2 more times before he was rushed to QMC. Think about it. I mean, if he has an incredibly high insulin, like low blood sugar, you're going to have to continue. He could have the sugar and then boom, because it's still circulating his system, he would have to get constant.
So it's a rebalancing act of constant
exactly.
levels.
Yeah. So, thankfully he made a full recovery.
Thank God.
And I'm going to get into a little while about what his blood work came back as.
Oh, yes. This will be interesting.
It'll be interesting, yeah. Okay. Next, we're going to talk about Becky and Katie Phillips. They were twins.
Yay for twins.
Yeah. And they were born premature. And they had to spend the first 5 weeks of their life being monitored closely in the NICU at Grantham Hospital. Their parents, Peter and Sue, couldn't wait for the little girls to come home. Imagine having to wait 5 weeks for them to come home. And they had like a lovely nursery set up for them. Everything was ready and waiting. But unfortunately, just 9 days after returning home, little Katie had to be admitted to the hospital because she had diarrhea and vomiting, like a gastro type thing. And so they wanted to monitor her and give her fluids and stuff like that. So Allitt was one of the nurses on the floor that day, and Sue recognized her right away because they had gone to school together. But it seemed like Allitt was just like looking right through her, ignoring her.
Yeah. Okay.
I mean, as a nurse, you don't do that. I mean, it could be the perception of the patient, but still, I mean, you're friendly and nice to everybody because even if you don't want to, you have to be. You know what I mean? It's your job.
Well, she's pretty messed up sounding. It sounded like in high school she wasn't, Yeah.
But I mean, you have to be professional.
Yeah.
And so after 4 days, Katie was well enough to go home. But so this is where it gets weird. But okay, she went home for a little while, but all 3 of the children got sick. So her sister Becky, Becky and their older brother Jamie, he got sick.
Okay, so the twins and their older brother.
Yeah, so they all had to go to the hospital.
So some sort of a bug, probably.
Yeah, exactly. So they were all admitted to Ward 4, and the whole family was practically living there. So parents at the bedside, 3 kids. Yeah, exactly. Paul also had he was married previously before Sue, and he also had a 16-year-old daughter at home. So it was a.
But she didn't get sick.
She did not that I know of. Yeah. Okay. So they were in the hospital for 5 days. The twins were discharged a couple days earlier, and then Jamie, and then they all went home. But the whole time they were there, Allitt didn't talk to Sue, and she wasn't in care of the kids then, and so she didn't, interact with the kids either. But you interact with all the patients. If you see them, you interact. Hi, smile, like whatever. You see, yeah, he's cute. You don't just, I can't think of a nurse would be on the floor that would interact only with their patients and not even, like, would just look through everybody else. So I just think that's really weird. So, so after a week in total, all 3 kids were discharged home. However, Becky just couldn't seem to kick this. So she was back 2 days later with projectile vomiting and diarrhea. So after further testing, it turned out that Becky was not tolerating her formula. So it seemed to be a formula problem.
That's the projectile vomiting.
Yeah. So they found one that agreed with her. They wanted just to keep her in for another day to make sure she was tolerating it. So she was ready to go home the next day. So this is where it gets really weird. The tiny bit of the things to come is that Allitt, who had not been caring, approached Sue the only time she spoke to her the whole time and said, "I don't think your daughter should go home. I don't agree with the doctors and I think she should stay." So that's odd.
Okay, so she basically ignored her the whole time, had nothing to do with the care of the child. Yeah. And then all of a sudden she's an expert thinking she shouldn't go home.
Exactly. So here's a quote from Sue. She didn't want her to go home. She said she didn't like the look of her and thought she should stay in. The sister on duty had a good look at her and said Becky seemed fine to her and told me I could take her. The decision seemed to annoy Nurse Allitt. End quote. So Sue took Becky home. Paul was at work and she was sort of settled in with her little family. Now they're all home. You know, things seem to be back to normal. Paul's back at work, etc. At about 8 p.m. that night, Becky started to scream and she appeared to be having seizures. I mean, you look back and you say she probably was, but you know, her limbs were shaking. And she was screaming. Paul returned home to find a frantic Sue. So he, relieved her, took Becky into his arms, and he let out she just let out a terrible scream. So they hadn't even been home for 4 hours. They didn't know what to do. And Becky started to finally settle. She fell asleep and they put her to bed. So she was sort of having this intermittent, pain and discomfort, and then she'd go to sleep. They thought it was gas, new formula, things like that going on. And so they thought it might be that.
Yeah, I mean, colicky babies, like when they have bad gas and stuff, I guess they can really wail. But it doesn't really explain the spasm.
Unless she was screaming so much that her little body was just like angry, and uncomfortable and they're, a little, but yeah, I agree with you. But okay, so once again, so it started again at 10:30 at night, and it looked like she was having like seizures, they say in retrospect. And so they called the on-call GP, and he was there by 11 o'clock, and he really felt that it was colic. Again, they were unable to settle her. And at 2:30, Katie woke up for her regular feeding. They checked on Becky, and they saw that her little body was in spasms. And I think now, she was probably having some kind of a seizure. But then she fell back to sleep. So with Sue, she thought she was going crazy. She was like, is this all in her head? Was she seeing things? Was she overtired? All normal concerns, especially for an incredibly exhausted mom with kids that have been in and out of hospital. Yeah, and in care since birth.
Yeah, preemies and.
Mm-hmm. So Katie was fed again, and Sue took Becky to bed with her and Paul just to keep a close eye on her. Sue fell asleep. And Paul woke her up distraught, saying that Becky had stopped breathing. Paul started CPR on the little girl, and they phoned an ambulance, but they didn't think the ambulance would get there on time. So they drove to the Emerge. He carried on with the CPR with her in the car. When they arrived, Sue just went to the nurses' station. They took her directly into the resuscitation room. But sadly, she had already died.
Oh my God.
Yeah. And there was nothing that could be done. So she died at, they said at 3:55 a.m. on April the 5th, 1991. So how did this happen?
Teeny little babies.
Yeah. What happened? What caused this? She had been home, I think, 12 hours. Less,
Could she have put something in her formula?
Well, we're going to get to all that. So there were no answers. The nurses and the staff, they were absolutely devastated. The doctors were baffled, and they were just like, what? They were just so upset themselves. So how did this little baby, admitted to the hospital twice in 2 weeks, one for 5 days once, 2 days next, and die within 12 hours of being discharged home? What did they miss? Was there negligence? It was just so like overwhelming. And she couldn't stop thinking about what Allitt said to her. Okay? But it's not what I thought she was worried about. Like, how did she know? She was like, she knew. She was right. Like, she was right, as opposed she was to setting her up. Yeah, because exactly. Okay.
Evilness.
We were saying earlier that, you were saying that there isn't a word, like, is there something worse than diabolical? Because every word you say just every word we say doesn't seem to fit how horrific, how terrible, how demented this woman is. Okay, and again, this will start to unravel itself, especially with these two, with this family. So now Sue had to rush home to get Katie, okay? And she was so worried that Katie may be sick as well, or still sick, that they went and got her, and the hospital admitted her for observation, just to make sure. Yeah.
No.
Yeah.
Oh, right into the jaws of the beast.
Yeah. And doing it for, like, as far as I'm concerned, a very reasonable, responsible, like, reason to do it.
Yeah, no, at that point I could see totally why they're like, oh my gosh, we just lost our other child.
Yeah.
Now we better make sure they're preemies. I totally rational response.
Yeah, so like not we knowing. Know, we have all the information, but then, so we go, no, but I mean, it makes sense, right? So 7:30 that morning, Allitt arrived for her shift, and she was assigned to be Becky's nurse for the day. So Allitt greeted Sue with condolences and assured her that Katie was in good hands and would be fine. But Sue was inconsolable. I mean, she was furious with the hospital, wanting to get answers. Now, the police were investigating because it was a sudden death, and this is what they do with any sudden death with a child, and I believe with adults even, like, not expected. So Sue was terrified for the life of Katie. She was literally, at the end of her rope. Allitt took full advantage of Sue and Paul's distress. She must have just been rubbing her hands going, okay, let's get started. She manipulated them in their desperation. The Phillips felt that Allitt was the only person that they could trust in the hospital. So these grieving parents were exhausted and in shock, and their grief was overwhelming. Paul and Sue needed to get some sleep. Okay, so they were, of course, afraid to do so. They wanted to stay at their baby's side, but Allitt encouraged the parents to go home and get some sleep. So they had no intention of going home and getting some sleep, but they thought, okay, we can go home, take a shower, grab some stuff, and come back. Because at that point, Katie was being observed. Okay, she wasn't, like, actively unwell. They had her there for precautions, and they had grown a trust for Allitt at this point. They're like, okay, we can whip home and whip back. And so Sue stated this is what Allitt said to her. Quote, "You go, I will look after her. She will be all right with me." End of quote. So reluctantly, the parents went for a little break, and they weren't even home for a half an hour when they got a call from the hospital. Katie was in respiratory distress, and they needed to get back there ASAP. When they returned, they found the little girl intubated and on a respirator. The most senior nurse, Jean Seville, was there, and she was assigned to give Katie one-to-one care.
Right, because Allitt was junior, right? She wasn't an experienced nurse.
Yeah. Well, at this point, because Katie had gone into respiratory distress, I mean, they needed some, like you said, more senior. So it was so touch and go that Reverend Ian Shelton spoke to the parents, suggesting that they baptize their 9-week-old. Again, Reverend Shelton has to get involved, to baptize another critically ill child.
Just in case.
Yeah. and the service was performed at her bedside, Katie's bedside. The next day, Katie was doing much better, and she was kept on the ventilator for precautions. And she was also hooked up to full monitors, and an apnea alarm was on her chest, attached to her chest. Any changes in her status would be detected immediately. So, again, Beverly was assigned to give one-to-one care to Katie, now that she was stable. With Katie being stable, Peter and Sue went to go speak with the Reverend about burying Becky. So they left Katie's bedside, who had just almost died, to go speak to the Reverend about a ceremony for their twin. So they returned to the floor shortly after, and they arrived to hearing Allitt screaming, "Recess, recess," while running with Katie in her arms. She had stopped breathing again.
Recess. Oh, resuscitation.
Resuscitation.
Okay.
She was yelling, "Recess, recess," running with Katie in her arms. So she ran with her to the resuscitation room, and in a minute, the room was filled with doctors and nurses desperately trying to save the little baby's life. Thankfully, they were able to stabilize her within minutes. So can you imagine what Sue and Paul were going through?
No, I can't, because I'm a twin. I can't even, I mean, I know they were only so old, but I can't imagine losing my other half.
And, you know, as a parent, and I know you can think through those eyes too, like, you just lost a baby. A baby, a twin, a preemie that was in the hospital for 5 weeks that you're so excited about, and now you're her twin is you know,
fighting for survival. Fighting for survival.
So instead of suspicion towards, I think I called him Paul earlier, and I'm mistaken. His name's Peter. Instead of suspicion, Peter and Sue were grateful that Allitt had been there and that her quick actions had saved Kitty's life. So the grieving parents were really angry with the hospital. How is this happening? So instead of being suspicious of Allitt, they saw her as kind of a hero, because if it wasn't for her quick actions, you know, Katie would be dead.
Right. Here's the Munchausen by proxy.
So,
center of attention.
Yeah, exactly. So the parents were like angry with the hospital, and they felt the only two people they could trust now was the Reverend and Allitt. So over the next 3 days, it was Beverly that went to one with Katie, and mostly by the request of the parents. And they never left her side. And they became very close with Beverly. They saw her as a godsend. So during this time, little Katie was put through a battery of tests, including a lumbar puncture, testing for meningitis. And her illness remained a mystery. On the third day, just when things were looking up, Katie crashed again. She suddenly stopped breathing again. So they battled for her life one more time. And Allitt just stood back and comforted the parents. You know, they're there. It'll be okay. The recess team worked on Kitty for over 30 minutes. So she had stopped breathing for 30 minutes.
Oh my God, that's dangerous.
And when they saw that they saw signs of life with her, they waited a couple minutes to see if she was stabilized, and then they flew her to QMC.
Thank God.
So
get her out of that woman's treachery. Away from that woman's treachery.
Unfortunately, the damage had been done to Katie. So Peter and Sue only left Katie's side for this reason: to bury her twin, their other baby, at St. John's Church in Manthorpe on Wednesday, the 10th of April, 1991. The official cause of death was SIDS, sudden infant death syndrome. And Sue couldn't believe it. She's like, she wasn't sleeping. How could she die in her sleep when she was screaming and shaking, you know? So, yeah. So they had no time to grieve. They had to return to little Katie's side. After a week at QMC, Katie was transferred back to Ward 4 at Grantham Hospital.
Why?
I know.
Why?
And she improved greatly. And they hoped that it would just be a short stay again. While Katie was recovering in Grantham, Kesteven, the other children were becoming mysteriously ill with similar illnesses. So so in that time, it wasn't just Katie and Becky. There were other kids simultaneously getting sick. And as you can imagine, the morale in the hospital was in the boots. So let's talk about Bradley Gibson. That you heard his voice. That it was in the clip at the very beginning of the episode. So he was 5 years old, and he was admitted to Ward 4 with pneumonia. And while he was there, he suffered a heart attack. He was clinically dead for 32 minutes. But he miraculously, as you heard, recovered and survived the attack due to the excellent care of the hospital.
How old was he again?
5.
5-year-olds don't have heart attacks either.
No.
Not generally.
No, not unless, they have underlying health conditions or like a heart problem, but he didn't. He was a healthy kid that, had a chest infection and got pneumonia. So how does a healthy child have
unless he went into respiratory arrest and then had a heart attack, but still, even...
If anything, the heart would stop. I mean, we all die of a heart attack in the end. We all die of heart failure in the end, right?
I guess.
Because all our hearts end up stopping, but you know what I'm saying. So they couldn't find the reason why it happened, and he was back at school 3 weeks later.
Sorry, I missed that. Did he go to QMC?
No, he recovered there.
Okay.
And then he went home, and then he recovered and went back to school. But he has had nightmares ever since. And there was a period of time where he couldn't control his bladder. He was having nightmares. He was having some weakness in his one hand. So, he suffered not long-term damage, the trauma of it. He still has nightmares to this day. But he was lucky. Thank goodness. Next is Christopher Peasgood. He was 2 months old. His mom, Cresswyn and Mick Peasgood, had lost a 10-month-old child 2 years earlier to SIDS. And this was their little miracle. They were terrified that Christopher could die of SIDS as well. So at 7 weeks old, he developed a cough, and it progressed, and he was having difficulty breathing and feeding, and the antibiotics weren't working. I mean, it's likely a virus, right? Anyway, he was admitted to Ward 4 on April the 13th, 91, and he was diagnosed by Dr. Nania Kara with bronchiolitis. He reassured them that he felt it would be a short stay, a trend, and they left that night. He was on oxygen, on an oxygen mask. They came back the next day. He was in an oxygen tent because sometimes babies just don't tolerate having the mask on their face. So, it's easier for them. And Allitt was assisting with his care. She encouraged the parents to go out and have a break and get some fresh air, of course. They were only gone for 10 minutes. When they returned, there was a crash team in his room working on him. Allitt comforted them while they watched on with horror of a crash team trying to save his life. So, not too long after he recovered and he was stabilized. At 8 p.m. it happened again. He had another cardiac arrest, and it was worse this time. And again, Reverend Shelton was called to baptize little Christopher. In fact, Reverend Shelton became his godfather because there was no one else.
Oh,
He became
my God, these poor parents.
And he was godfather to a couple of kids there because of this. He was transferred to QMC, and like the other children that had been transferred, he recovered well.
Miraculously?
Yeah, and he went home.
He didn't have a psychopath nurse looking after him?
And poisoning him.
Interfering with his
So he
care?
he went home 3 days later, and the day that he went home, another child, Patrick Elstone, was admitted to Ward 4. And he was 7 years old at the time. His parents, Hazel and Robert, and twin brother. He had a twin brother, Anthony, another twin.
No, yay, twins.
So he developed a cold and couldn't feed. So it's, the same type of that. So he was admitted for observation, supportive care, and he was recovering well. And within 48 hours, he was near death. He had suddenly stopped breathing at 8 p.m. The hospital was arranging to have him transferred to QMC. And he recovered fully.
Thank God for that.
Yeah. So little Katie was in the hospital at the same time that Patrick was in the hospital. And they were kind of in like close to each other. If you can imagine like a room and there's sort of like a curtain in between, they would be on each other's side of that, right? 1 and 2. Right. And Sue remembers seeing Allitt running with Patrick in her arms, yelling that he had stopped breathing. So she remembers witnessing that this happened. Okay, so...
How old was Patrick again?
He was 7 weeks old.
Okay, and then he got transferred to QMC and
yeah.
then recovered. Okay.
But she remembers the moment when it happened because she was there and she saw it happen.
She was probably running and saying, recess.
Yeah, exactly.
I'm here to save the day.
And she also saw Patrick's parents returning to find their child in respiratory distress, like all the other ones, or failure. And Sue was grieving herself. But you find out that Sue and Paul, we talk quite a bit about him. Peter, sorry. They were comforting Hazel and Robert, knowing that she had gone through the same thing. So she was comforting them.
God bless them.
And this is what Hazel Elstone was quoted as saying. I couldn't believe it. When I left him, he had been playing and cooing. It wasn't the same child in there. I just looked at him and said, oh my God, look at his color. The sister dropped a blanket over him. Robert and I were just hanging on to each other.
I love baby cooing sounds.
Oh, I know. They're the best.
The thought of babies
the smell of their head and that little cooing and the little smiles. Oh, God. I can't wait to be a grandma. Van, just saying. Shortly after they arrived at the intensive care unit, they asked if they wanted to baptize Patrick. And they did. So that morning at 7 a.m., he was improving and he would continue to do so. So through the night and then into the morning, okay, he's stable, he's doing well. And he would over the next couple of days. And he would go home soon after that from QMC and he fully recovered.
Oh, so he did go to QMC, that's right.
Yeah, and then he was discharged home from there. Thank goodness. Okay, but the staff at QMC are like, what the hell's going on with Grantham and Stephen? Because they may get one kid a year come over there, one sick child. And they had gotten 5 in 2 months.
Yeah, it doesn't happen in a small
So they started
like
to talk to a senior consultant at their hospital saying, like, you need to look into this. Okay, so next we're going to talk about Claire Peck. She was 15 months old, the only child of Sue and David Peck. She had a history of asthma. She was admitted to the hospital on April 22nd, 1991. She had increased difficulty breathing over 2 days and was on a treatment of Ventolin at home. And the doctors felt that, it would be a short stay. Asthmatics recover really quick. I've seen it in working the merge. It's just amazing. They'll come in like really, wheezy and their oxygen is low and they're really struggling. They're tiring out. They're not able to eat. And then we give them like a pulse of Ventolin, Atrovent, oxygen, that kind of stuff. Just kind of slam them with it. Maybe some dexamethasone. And it's like, is that the same kid? They recover fast. And then you monitor them, make sure that they don't have any rebound, symptoms. And then you send them home on a kind of, I don't want to say aggressive, but a steady prescription of Ventolin and that type of stuff at home.
Keep the inflammation down.
Yeah, exactly.
Get that cycle under control.
Yeah. So she recovered quickly. And after a couple hours, she was discharged home with Ventolin syrup and a puffer. I can't tell you how many times that's exactly what happens in the hospital or when I worked. They'd come in, they'd be there for a few hours. We monitor them, send them home. And that usually would be enough for them to have the puffers at home, follow up with the pediatrician and so on and so forth. So the next 24 hours went very well. Claire seemed mostly to be back to her normal self. So she was back at home. They talk about how they spent the day out seeing grandma and grandpa. Things were, they had a really lovely day together. Their little girl was doing really well. But she started to wheeze again and had some shortness of breath that had come back. So they really hadn't, unfortunately kicked it. So Sue treated her with Ventolin, and then around 1:30 to 4:30. So she gave her a treatment at like 1:30, and then 4:30, and then 6:30, and it didn't help. And the on-call doctor went to them with a portable nebulizer, which sort of, gives a steady, instead of trying to just give the puff, it gives them a steady dose. And it gets into their system a lot better. He returned again at 2, and there was no improvement. So he said, okay, we need to take her back to the hospital and give her some more treatment and observation.
Is that like 2 in the morning then?
No, 2 p.m.
Oh, 2
So it was
p.m.,
throughout the night, yeah. Her condition worsened after she arrived, and then she went into respiratory distress and became cyanotic. She was placed on full monitors, oxygen, and nebulizer. Sue Peck commented when she arrived to the floor that she saw Allitt sitting at the desk, and she remembers her from a visit before, a few days earlier. Allitt had been very rude and even hostile towards the Pecks. She was also very cold towards little Claire, showing little interest in her, and like she wouldn't even engage with her. You have a 7-week-old baby, and you're in and out of rooms checking on things. You're going to be like, oh, I don't care.
It's like any normal person.
At what day or what time of your career.
7-week-old baby.
Yeah, and you'd be like, you poke your head into different rooms and you go, oh, how's it going? Like that. That's what part of being a pediatric nurse or doctor is. Like you have interest in the well-being of kids, and who can't help seeing a little kid and or saying hi and smiling to mom and dad, or, make them feel comfortable and safe, that kind of thing. And Claire said, talking to the little girl, like, she doesn't want to talk to us. Who cares? No big deal. And Sue said that when she saw her, immediately she didn't like her. So when she came back on the floor, it's like, oh, it's her. Claire ended up...
evil meter was going off, probably.
Yeah. I wouldn't like a nurse, too, if they were... I mean, you don't have to like your nurse. You just have to be respectful to your nurse. And if you're worried that, you're getting, insufficient, poor care, you talk to somebody. You're not like, but you can say, look, I'm uncomfortable.
I mean, how much effort does it take to say hi?
It doesn't, because she's, a complete...
This is a woman who was like, wanting to work with children. You'd think like people who love to work with children. I mean, I know how much you love working with kids. Yeah, that just shows you how much of a psycho she is. So Claire was intubated and placed on a ventilator. The doctors had to prepare a special medication for Claire. This is like a very delicate... I'm not sure exactly what they gave her, but it was like very specific doses of things. So they were preparing it. And Claire was left alone in the treatment room with Allitt, but also a senior nurse. So they were both at the bedside to make sure that she remained stable. But then Allitt suggested that the nurse that was with her go get Claire's parents, who had been in the waiting room this whole time while this was going on. And so now Claire was alone with Allitt. How convenient. I'll look after her.
Yeah, you go.
You go.
I'm right here. Do you mind going and getting Claire's parents? Within seconds, Allitt was calling for help. And little Claire had stopped breathing, and her heart had also stopped. Claire's parents rushed back into the room, and they saw the crash team there trying to save her life. When they entered the room, they saw that what her little body was going through. And she said to them, stop it. I think she's had enough. Like, just stop.
My heart just breaks for this. How do you make that decision?
I think that when they saw that what she was going through, they were just, don't do it. Don't put her through it anymore. I know.
I mean, you can see me. I have tears in my eyes right now. I don't even know how you make that decision. Such a little kid.
I know. But I mean, I think they knew, and I think that they just, they didn't want her to continue with, getting this aggressive treatment. And it really is,
traumatic.
David remembers seeing Allitt that was sort of sitting behind them, and she was just staring at them.
Sorry, say that again?
So Allitt was kind of behind them.
Who remembered seeing?
David, the father.
Oh, okay.
So they were standing there and watching, and Allitt was sort of to their side and back, and she was just staring a hole through them and just listening and watching what was going on. She was
very sick, unwell person.
Yeah, that she's like fucking enjoying it, right? This whole everything she had just caused. She was just, yeah. So Sue and David realized that there was no hope of saving their little girl and asked the doctors to stop. So they, wrapped her up in a blanket and held her and just and said goodbye. So while Sue and David grieved, Allitt was trying to draw attention to herself. I think this is where we're going to stop, because there's so much more that went on. I thought maybe we could wrap it up in one episode, but there's definitely way more.
Part 3.
There's a part 3, and Mary and I are going to record in a couple days once I get this done and out. And Mary's off in the morning, so we'll record this, and it's just it gets worse. And you'll see. I just want to talk a little bit about resuscitating a child that is so critically ill. And I have, on occasion, obviously, been a part of the resuscitation team. And it's a very difficult decision when to call it, especially when it's a child. You don't ever want to stop. No one wants to stop. And you have the energy to go on forever if you have to. But there's that point where you have to.
It's just got to be heartbreaking.
And what you're putting the little bodies through is absolutely horrific. And you don't want to do it. But you have to try. If you got that little bit of hope, you have to try. And I'm not going to get into any details, but just trust me when I say that, you have to put lines in. You have to do CPR. You have to inject medications. You have to do a lot of things. Their body goes through a major trauma when you're doing that. So when it's clear that there's nothing more you can do, you have to stop. And again, I don't think it's ever an easy call. It may be the obvious call, the right call, but it's never the easiest call. So when I'm listening to this, I think about what the parents are going through as a parent and just as a fellow human being. But I think about what the doctors and nurses are also going through. You're trained to do this, and you have to block out your emotions, so to speak, but you have to maintain those emotions and that compassion and that empathy. You have to contain that because you have a very serious, important job to do. And if one gets mixed up with the other too much, then you can't be effective. But I know that feeling of not wanting to give up, but also knowing that there's nothing more that can be done. And it's fucking horrible. Like absolutely horrible. And there's times when I've been working on children and the parents are screaming in the back. Like screaming in horror. Punching walls. Fainting. Because they're watching their child die. And it's just flying all around. And so when I read this and tell the story, and that's why it's really important for me to tell the story of the victims. Because I could just go on about Beverly Allitt and list the victims. But I want to tell their story. Okay, so anyway, that's where I'm gonna leave it there.
Yeah. It just makes you think about how anybody could just, like you said, she just like look through them, like how.
Because she is enjoying it. She was thoroughly enjoying herself. This is a woman that doesn't just have Munchausen's. She has Munchausen's by proxy. So you tie all those things up together. Her need for attention is so insane. So deep and obsessive that she'll do anything. And then I think about, where does her rage come from? How do you injure, hurt, kill a 7-week-old? Like, where does that come from? And I don't know. How can we know? How do we know? Before we end this, I've got a few people that we should be thanking.
Yes. I
want to give out a big shout out to our new Patreon supporters. Thank you to Amanda Daly.
Thank you, Amanda.
Jody Connolly.
You're the best, Jody.
Cora Wolgamuth. I hope you said your name right.
You're awesome.
Leanne Williams.
Thank you, Leanne.
And Stephanie Porter.
Thank you, Stephanie.
Holy crap, guys.
Holy crap.
Holy crappity friggity frig.
Thank you from the bottom of our hearts.
Yes, this is absolutely amazing, all of you that support us on Patreon, and we're just going to keep on putting out great content. And for those of you that are interested in supporting us through Patreon, go check it out. Stat Shocking Traumas and Treatments. You can see the perks that you get, and we're just going to keep trying to make them bigger and better each week that goes by.
We're going to have a special episode.
Well, they
soon
they'll get extra episodes and
written by me.
Yeah. Oh yes, Mary has a new one coming up, but shh, we won't say anything yet because I want to thank everybody who leaves iTunes reviews. They mean a lot, more than getting the show seen and out there. It's like I read them, I'm like, Mary, look, check this out, and I read it to her, and you are like, yay!
Yeah. Well, it's just so nice to hear feedback, you know.
Yeah, and no, it's amazing. Thank you to everybody that's on the Facebook group. You guys are incredible.
It's the best group ever.
You're our extended family, and yeah, thank you. You're all amazing. I love your support. Your listenership means the world to us, and just keep taking care of yourselves and
staying safe.
Yeah, God, stay safe out there. Absolutely, and love each other, and most importantly, love yourself.
Peace.
One love.
True crime and it gets none realer. Sometimes it'll be the cure that'll kill you. Gotta watch out, yeah, you gotta watch your back, cause you don't wanna be another episode on Stat. Thank you for tuning in, learn a thing or two. These medical mysteries can be unbelievable. Yeah, subscribe, make sure you do that so you'll be tuned in and be ready for the next show. Stat.